I had the distinct pleasure of interviewing Dr. Jeannette Mahoney. She's an associate professor of neurology and associate director of the Division of Cognitive and Motor Aging, and all of this at Albert Einstein University. For my viewers out there who are concerned about fall risk for themselves or a loved one, you're going to want to watch this. One of the things I notice with my clients who are all over 40 is that for the clients that have poor balance, just as an example, I notice that they're looking where they're going. They're relying on sight so much, and they can't look up. They can't really look up. Do you care to elaborate on why that might be happening or providing us even more insights?
So it's funny that you mentioned gait, because in the lab, we actually study quantitative gait. And as you'll see in this video, there's footballs. And what happens in those footballs is as the person walks on these quantitative gait mats, which have tons of sensors in them, you can actually get over 100 variables that look into gait. And some of the main ones that we really pay attention to are the obvious ones, right? Like gait speed. How fast is one walking? We also like to care about stride length. And then sort of the variability measures, like are there differences in stride length or how our cadence, our swing time, different variables that really go into this complicated gait cycle. And if so, how does just looking down, or how does being able to process multisensory information, why would that matter? Well, it turns out that there are areas in the brain, especially in the cortical and subcortical areas, that are like efficiently designed to have communications from the top to like the basal ganglia and other areas that keep us upright, that keep us moving, that keep us balanced and not tipping over. And what we found in almost 333 people was that gait, specifically pace, which combines gait velocity, stride length, and percent of cycle that has both feet on the ground. So during that active walking cycle, there is actually a time when both feet are on the ground. And the more that happens, the less you're walking well, right? So we found that people that could integrate well, those are not the people that are just focusing on vision. Those are the people that are being able to take in all the information at once. Those are the people that have faster gait. The thing about slow gait is it's a predictor for many things, including Alzheimer's disease and dementia. But here, our results, really significant, even after controlling for many covariates, show a very significant association between how well somebody integrates and how fast they walk alone, just the gait velocity, but also the entire pace factor. Besides gait, multisensory integration was significantly linked to falls, history of falls, as well as incident falls. When we studied people longitudinally over 3 years, we found that people that didn't integrate well were at a 24% greater likelihood of having a fall compared to those who integrated well. And that's a big number. That's like 1 in 4.
Wow.
So on the flip side of that, people who integrated well were at a 76% less likely chance of having a fall. Falls are one thing, but falls are multifactorial. There's so many reasons why one could fall. One could be poor balance, one could be poor gait, one could be environmental factors, things we can't control, like slipping on the ice. I mean, anybody can do that at any age, right? But the thing about it, as we age, is that we know that there's this breakdown in our musculoskeletal systems. We know that our unisensory systems are slowly deteriorating, whether it just be from age or environmental exposure. And so what we found here is that if we could really tap into something novel by having people respond to this multisensory test, could we actually find other ways to predict falls? And would those sort of limitations in both integration and motor impairment be associated with cognitive impairments? And the answer is yes. So I've shown you that we've talked about poor multisensory integration being linked to poor gait. We've also had it linked to falls, and we've also had it linked to poor ability to stand on one leg, which is the unipedal stance test. What happens here in this study is we really wanted to better understand if cognitive impairment actually had an influence on the relationship that we found between gait and balance with visual somatosensory integration. And what I'm showing you here, and it looks the same as before, is about 345 people, of which 293 adults had normal cognition, 40 had mild cognitive impairment or MCI, and 12 had dementia. These were all case conferenced using standardized measures with a multidisciplinary team. And what you can see here is the people with normal cognition, which makes up the majority of the sample, have this beautiful peak with this nice area under the curve over that first 10 percentile, suggesting that overall, normal people show great multisensory integration. But as you look at the gray and the black lines, you're beginning to see that those individuals with mild cognitive impairment, and further those with dementia in black, really don't integrate at all. Now that was a not super surprising, but what I wanted to know was what would the effect of this poor cognition, if any, be on the relationship between what we just talked about, which is multisensory integration and balance and gait. And it turns out that cognition does in fact mediate the relationship, suggesting that if you have poor cognition, then you very much likely have poor visual somatosensory integration and poor balance. So it's like this trifecta going on.
So when you're referencing different parts of our system that decline, and often they're considered age related, are these the type of components that are more like you don't use it, you lose it? Or is it something that we kind of can't help but lose? Is there anything that can be done to improve our cognition, balance, and somatosensory, or the touch sensations in the body?
That's exactly what we're trying to uncover. And the idea is we know that there are certain interventions that are very helpful for different things, right? Whether it be watching your diet, keeping your brain activated using cognitive games or exercising, or even something like doing Tai Chi. All of these courses or these action items are helpful in delaying the onset, right, of potential cognitive impairments. But what we don't know is what combination, right? Like, do I need to just really work on the physical? Should I really be doing more crossword puzzles and, playing more games? Should I be doing a little bit of everything? That's what we don't know. And so the studies that we're about to be doing, or that we are currently running under this new $4.2 million grant that we got from the National Institute on Aging, are really set up to allow us to look into the brain to see exactly which areas are not lining up or are not working efficiently for older adults that don't integrate. Because once we know the areas that are sort of either atrophied, meaning like there might be some cortical thinning, there might be reduced volume. Once we know those areas, now we know which areas to target to try to come up with the best interventions that we can to figure out, well, how can we increase cognition? How can we increase physical activity? How can we increase multisensory integration? So these are sort of like the unknowns, but they're my future goals in trying to understand. And I think once we really can get into the neuropsychiatry and figure out where those deficits are occurring, then we'll have better ideas as to which are like the top 3 or 4 interventions that we think will be most helpful. And then we can systematically test those out in other randomized clinical trials to determine what we think would be the best sort of treatment to provide older adults to help them not go down this sort of slippery slope.
That's excellent. So essentially, you're trying to find, through your research, your intention for the future is to find that the perfect group of prescriptions. Exercise. Is it exercise? What type of exercise? Games that you can do or not do? What is wasting your time and what is actually benefiting? If I'm understanding correctly, that's your intention.
100%. We need to know from a complete systematic review as well as an empirical study, which are the best sort of interventions or combination of interventions. What is the perfect amount of, duration, intensity, how often should people be doing this in order to target sort of what we would call sensory cognitive motor training.
I think a lot of people on my channel, they watch the videos, they learn a lot, and then they want to take action. They want actionable steps. What can be done? What's something concrete that hey, I need to do something, what can be done? What would be your recommendations?
I think that the best recommendation, given if we don't know the details of what's going on, would really be to sort of engage in those exercises that really focus on strengthening your core.
Okay, specifically core. I'm glad you mentioned that because that's a lot of what I do with my clients. A lot of corrective exercises, core stabilization.
those sort of exercises that get at your core are very important for balance. I think, and you'd probably be able to elaborate more than me on sort of how that plays into everyday mobility.
I hope you enjoyed this interview on fall risk. For any individuals who want more information about Dr. Mahoney or resources to help them improve their balance, click the links in the description below. I do offer one-on-one coaching for individuals that are concerned about their fall or have already received the suggestion by their healthcare provider that they should work on improving their balance. I do offer custom one-on-one programs at the recording of this video, and I do offer pre-made programs as well. I am a Tai Chi certified instructor, which has been scientifically proven to reduce the risk of falls, and I can incorporate that in your workouts if you would like. I have something for everyone. That concludes this video, and always remember, your health is an investment, not an expense.